Tonight with the big story, the health scare in Macomb County.
Right now, government investigators are trying to track down the source of an outbreak of Legionnaires Disease at a hospital, and that has patients on edge.
This all centers around McLaren Macomb Hospital in Mount Clemens. As we first told you, 7 people who spent time there were diagnosed with the disease.
Legionnaires is a serious type of pneumonia caused by a bacteria that can spread in water systems like sinks, water heaters, and plumbing. It can be spread from drinking water or from small droplets in the air. 7 Action News reporter Jen Shantz is live at McLaren Macomb tracking new developments. And Jen, what have you learned?
In a statement, staff here at McLaren Macomb Hospital says the definite source of this exposure is unclear. A spokesperson says they haven't had to move any patients at this point, but the hospital is taking extra precautions, like testing their water more frequently. The bacteria that causes Legionnaires can grow in water. However, the hospital says it hasn't found any in its water supply in recent tests. 7 cases of the disease linked to McLaren Macomb have been reported since late July, 6 of them just last month. Ann Casada is said to have back surgery at McLaren Macomb next week when she found out the county and the state are looking into 7 cases here.
A little concerned. My husband told me about it. He heard it on the news last night, and that's the first I heard of it at 11 o'clock last night.
According to the hospital, a letter to all current and future patients went out this afternoon. Patients who were discharged within the last 2 weeks were also notified.
I just had family here in the emergency room recently. So it's super scary.
The head of the hospital's nurses union says the hospital hasn't been transparent.
We've been having issues with water at the hospital since midsummer. They put signs over ice machines. They brought in bottled water. Never once informed the nurses, the workers, or the patients that they were having issues.
We reached out to the hospital for a response and are waiting to hear back. Legionnaires can cause a cough, difficulty breathing, and severe diarrhea. People over 50, former smokers, or those with underlying illnesses are especially at risk. According to the CDC, the disease is usually treated successfully with antibiotics. The investigation into these cases is ongoing. We, of course, will stay on top of this story and keep you posted as we learn more. Jen Shantz, 7 Action News.
All right, Jen, thank you. And we have much more information about Legionnaires' disease, the symptoms, and what to watch out for on our website, WXYZ.com.